Hello everyone, welcome to sqadia.com. My name is Saima Mushtaq and our today's topic is urinary tract infection. We divided our lecture topic into 5 sections. In the first section, we will cover the classification and stages of urinary tract infection. We will also talk about predisposing factors of urinary tract infection and why the urinary tract infection is more common in females. We will also talk about routes of infection, pathogenesis, and approach to the patient. Then in the second section, we will talk about some clinical presentations of asymptomatic bacteriuria, urethritis, and urethral syndrome. And then also we will talk about cystitis, sterile pyuria, and pyelitis. In the third section, we will talk about management and treatment of urinary tract infection, how we can prevent urinary tract infection, what are the management principles of urinary tract infection, and what is the treatment for urethritis and urethral syndrome. Then in the fourth section, we will talk about dysuria and urethral caruncle. We will talk about what is dysuria, what are the causes of dysuria, what is urethral caruncle, and what's the differential diagnosis and treatment. In the fifth and final section of our lecture topic, we will talk about some voiding disorders, which are retention of the urine, how retention of the urine is managed, and what's the difference between acute and chronic retention and how it is treated. So that's all we will talk about in this lecture, and hopefully you are willing or interested to learn more about this lecture. So keep watching sqadia.com.